Hey guys, it's Dan here from the Physio Channel, and here we're looking once again at the lumbar flexion debate. So, are you or your patients still lifting like this? Or perhaps a different way like this, with more flexion? So in this presentation, we're going to talk about the lumbar flexion debate. The lumbar flexion, lower back pain debate is now simmering down, but is still a hot topic. So here's a little update for you and your patients on whether they should or shouldn't have lumbar flexion when they're lifting objects. Now, lifting with flexion in the lumbar spine is not associated with back pain onset, now or in the future. In fact, a recent systematic review, which I'll put in the description, reported evidence of this non-association. So biomechanically, the difference between a straight extended lumbar spine or a flexed lumbar spine when lifting does not seem to alter disc pressure. Now, I've read studies that might disagree with this, but what does seem to matter more in terms of pressure and pain is the position of the load relative to the body, the load itself and the level of repetition. So if Rich was to lift that weight close to his body, that's going to lead to less pressure and less likelihood of pain and discomfort. But if he has it further away from his body and attempts to lift it like that, that's much more of a problematic factor, and that's what we should be focusing on rather than whether the lumbar spine is dead straight, extended or in a flexed position. The weight should be close to the body. And then there's also repetition as well. There is a link between repetitive lifting and the increased incidence of lower back pain now or again in the future. So reducing repetitive tasks and lifting with the object close to the body are two bits of advice that are evidence-based that we can share with our patients. Now, this is not unique to the spine, of course. If you take any part of the body, you'll experience pain if you stress and strain it enough with enough weight and with enough repetition. So we still need to pay some attention to how we teach our clients to lift, but this needs to be balanced against the need to improve their movement confidence and willingness to lift. How's that feeling? Good enough? Not teaching strict lifting practices for back pain is good practice in itself. Teaching a variety of lifting styles is a good idea for the patient. And that brings us to the patient with back pain who is already lifting like this with a fear of flexion and a very set movement pattern. So we're talking about why a patient might be lifting like this with this very precise and almost fearful way of lifting. So we can consider the psychological, physical and social factors that affect this. Because they have increased sensitivity in the lumbar spine, this may be preventing them from performing a comfortable lumbar flexion, either when they lift or during normal functional tasks. They may also have a fear of pain when they flex their spine, so that leads them to not even try to flex their spine as they avoid that movement in the first place. And of course, they may have been told to keep their back straight by a very important person, like a medical professional, for example. And I'm sure you've all seen patients that have been given that advice by other professionals. So it's your job, our job, to debunk this misinfo-twaddle and restore pain-free movement.
So Dan, should I always lift like this then?
That's a good question. So what the research indicates is not that people should stop lifting by bending their legs and keeping their back straight. It's indicating that that's less important and can sometimes be problematic if it's there because people are fearful about lifting in different ways or people are fearful about flexing their spines. It's not to say that lifting in that particular way is inherently wrong. And in fact, we want to reduce the fear of movement and introduce more movement variety. There's a protective element to increasing more movement variety. So if you can lift in a variety of different ways, not only are you more confident in lifting, but when you do go and lift things in normal daily life, your body is adapted, and that's a key word there, adapted to lifting in various different ways rather than only lifting in one precise way, which would of course potentially cause problems if you were forced to lift in a what you would class as an unusual way. So if you do that movement again, as a physio, I would not advise people to always lift with this kind of perfect technique, or advise them to always lift with the flexed version as well, because stopping somebody lifting in one way and getting them to lift in an entirely different way, the tissues have not adapted and they're not adapted to moving in that way. So I would look to introduce variety and other ways of lifting and try to encourage flexion through the lumbar spine, perhaps without any load in the first place, with the key messages being try to avoid excessive repetition of lifting, which is usually something that would be work related, and to keep the weight close to their body, and also to try different variations as part of a training program rather than always lifting in one way. And if the person is thinking about, if we're looking at a performance setting where somebody's lifting a very heavy weight, then yes, we want to lift in the most biomechanically advantageous way possible, which is of course to use the lower limbs and to keep the back straight to take advantage of the lumbar erectors working efficiently. You wouldn't be able to lift a heavy weight, and it wouldn't be sensible to do so with a flexed spine. The amount you could lift would be much less. But having that as an option for lifting things, you know, in the shops or in the garden or in the garage is definitely an idea and something you want to build into a training program. So there is no set way that people should lift. They should have the ability to lift in a variety of different ways without any of them causing any discomfort or pain. Here on the screen are some other videos that may help you to achieve this, and make sure you subscribe for more content arriving on the Physio channel soon.